The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. This is something special tonight. I'm Dr. Lederman, board-certified internist, board-certified medical oncologist, board-certified radiation oncologist with a new cancer program, Radiosurgery Hour, on WOR every Saturday night, unless it's interrupted by Rutgers football. So here we are, our sixth show of the weekend. We have Noah and Ed running the studio, and we're live. You're welcome to call us if you have any question about cancer treatment. WOR studio phone number is 1-800-321-0710. 1-800-321-0710. We're live in the heart of New York City, taking your calls, bringing you information about better health, how to live longer, how to spend less money, how to get more health care for less, how to get better health care. Those are the topics that we'll be talking about tonight. We actually have 6 shows every weekend. We have a show on WABC at 5 to 6 on Saturday morning. And then on WOR, we have lots of shows tonight from 9 to 10, this show, from 1:30 to 2:30 a.m., a new show, from 3 to 4, another show, from 6 to 7 a.m. on WOR, another show, and then to wind up the weekend, 9 to 10 p.m. Sunday night. So we're happy to take your calls. We're happy to answer your questions. We're happy to provide information. And we're going to get going. I just had a thought. So the government is trying to keep out people with Ebola by taking their temperature. Now, people probably that have exposure to Ebola probably very much want to get American health care. Wouldn't you imagine that's the case? And wouldn't you imagine they'd probably take a couple aspirin or Tylenol if they have a temperature and bring down their temperature to get in the country, to get to an American hospital? So I wonder how this administration is going to deal with that, because I think people are pretty smart, and if they can get in this country without insurance, by masking a fever, which is pretty easy to do, they probably will do it. So I'd like some answers from our administration. Maybe the president or secretary of health will tell us how they're really going to keep out an epidemic from this country. And obviously, each one of us can be severely affected, may even die by exposure, and sometimes it could even be unknowing exposure, like that nurse in Spain who apparently is doing very poorly. She's the first case outside of Africa with Ebola. So please tell us, Mr. Obama, how you're going to protect this. I don't think taking temperatures of passengers is going to do the trick. We'll talk about that as the weeks and months go on. If you have comments, welcome to call. We're really a cancer treatment center, but I couldn't help thinking about that. I want to talk about a patient who made a big impact on me this week, and this is a patient, of course I won't tell you his name, everything is private and confidential, but it's a man that I spoke to a variety of doctors about because the impact he made on me. This man was 56 years old, he is 56, he's married, he came with his wife and children, and he has a particular kind of prostate cancer called small cell. Now, small cell cancer, you might think about, usually starts in the lung, and you're right, it usually does start in the lung. Usually is a smoking-related malignancy. Well, small cell can start anywhere. And small cell cancers usually respond to chemo. They're usually aggressive. They're usually difficult. Well, this man went to a big cancer hospital, you can imagine. He had pelvic pain. He had a biopsy. He didn't have the typical prostate cancer. The biopsy shows small cell in him, which is not what most men with prostate cancer have. He already had involvement of adjacent lymph nodes. He started on chemotherapy. He had chemo. First chemo combination therapy didn't work. This mass was so big, the mass in his pelvis was so big it was compressing the bladder and the rectum. They had to put a catheter in, and he's had a catheter in for more than 6 months to urinate. And he's had tremendous difficulty with bowel movements because his mass is compressing the rectum. The chemo didn't work. And so what do chemo people do if the chemo doesn't work? Yeah, you got to give him more chemo. So they gave 3 more cycles of a different chemotherapy, just ended a couple of weeks ago. It didn't work either. This man has had tremendous pain. He came into my office on Tuesday this week, and he couldn't stay in one position for more than a second. He was squatting, moving to the right, the left, standing, leaning, extending his body, stretching his body, doubling over in terrible pain. Even though at this big cancer hospital they put him on morphine, it wasn't doing the job. The chemo wasn't doing the job. The treatment wasn't doing the job. He came to me on Tuesday, and he was supposed to have a colostomy surgery on Wednesday. They were going to open up his belly, bring out his intestines to his abdominal surface, put on a plastic bag so his feces would be caught in the plastic bag because his mass was so big. Their chemo wasn't helping him. Their pain medicines weren't helping him. That was Tuesday. I saw him Tuesday afternoon, examined him, spoke to his family, got him staged up, adjusted his medications. We gave him radiosurgery, spoke to him on Friday, actually spoke to him Thursday as well, asked him how he's doing, and he said, "I'm fine, thank you." And I saw him. He wasn't stretching. He wasn't going around. The pain was pretty much gone. He was feeling great. He canceled that colostomy. He had radiosurgery. He adjusted his medications. Wow. What a difference a day makes. 24 simple hours. What a difference a day makes. For this man, one day, one consultation, 1 second opinion made all the difference in the world. Had he not come for a second opinion on Tuesday, he would have been in the hospital today convalescing from a colostomy, which he didn't want. He didn't want it. His wife didn't want it. His daughters didn't want him to have colostomy. No. And luckily, he came to Radiosurgery New York. He got a fresh second opinion. He got a fresh approach for cancer treatment. We are treating this massive mass in the pelvis, small cell cancer, with radiosurgery, 5 treatments. We make a stereotactic frame. Everything is pain-free, no pain. Everything is outpatient. We make a stereotactic frame. We computerize what's in his body. We computerize the tissues, the cancer, the bladder, the rectum. And then we send in beams to hit the cancer. And overwhelming success is usually had. And how do we know? Well, we prove it to you. You don't have to take our word. We don't even want you to take our word. We want you to get the proof, get the follow-up scan, and you see for yourself by an independent group of radiologists. You will see the results. You will have the pictures. You can compare them yourself. You will have the report. You can see for yourself. You don't take our word. Let's get the report card. The report card is good for you, good for us, independent, and it proves our work. And we do that with every patient. We want to prove our work. This man had a very rare kind of cancer, but thanks to our massive experience with more than 20,000 cases over 20 years, we have a tremendous experience. We were able to save him from the colostomy this week. We were able to get him out of his pain. We were able to treat him and change his life. We have another patient I want to talk about from the also good news department. This past patient was really the good news department. It was good news after a day. Well, this man is good news after a year. He came to us from Colorado with a PSA 19 Gleason 8 cancer, prostate cancer, the usual kind of prostate cancer, and treated him with our premium program, and his PSA is down to 0.33. Doing great, sexually active, urine life intact, not like with open surgery, not like with robotic surgery. Just to recall, there was a study at Harvard that looked at sexual problems after surgery, robotic or open. 97% of men reported sexual problems after open or robotic surgery. 80% reported urinary problems after open surgery, and 86% after robotic. So robotic seems to be going down the tubes here. This is the data. It's not me. You can check online, or you can call for our booklet, which we'll be happy to send to you. But that's the data. High complication rates with surgery and not very good success. In fact, if you look at our booklet for, let's just say, for this gentleman's category, PSA 10 to 20, and that's on page 11 of our booklet. With surgery or standard radiation, the success rate is 60%. With us, we're at 90%. So when you can have an improvement of 50%, it's obvious why so many men come to us for prostate cancer treatment. And there's this whole brouhaha about proton beam. Well, if you open up page 9 of our booklet, you'll see us versus proton beam data, and let's just say Gleason 6-7 results. The big proton facility has a 76% success rate. We have 87% success rate with the radiosurgery frame and brachytherapy. That's 14% higher. So if you think about it, 250,000 men have prostate cancer. 14% means about 35,000 lives saved if they come to us rather than proton beam. Obviously, the cost is less with us. Obviously, the experience is greater with us than proton beam. But the data is here, page 9 of our prostate booklet, and we're happy to send it to you at no charge. By the way, for the high-risk patients, Gleason 8, 9, 10, proton beam gave a 48% success rate. Our results are 46% higher. So, yeah, you can spend more money, but your results will not be better than with Dr. Lederman and Radiosurgery New York. We're conveniently located at the corner of 38th and Broadway, 1384 Broadway, in the heart of New York City. We're close to the trains, the subways, the buses, Penn Station, Grand Central Station, PATH trains, Port Authority. We're super convenient, but we're not only super convenient. I think are super. We answer our calls. There's no machines. Real doctors will treat you, not the students, not the residents, not others. Real doctors who will speak to you, who'll give you their phone number. You can call it day or night, so you're not lost in the maze of a hospital system that you can't find your way through. We're going to stop for just a moment. We have several new voices that are going to tell you about our work, and they'll be right back. We're on WOR, by the way, and Ed and Noah are ready to take your calls at 800-321-0710. That's 800-321-0710. We'll be right back. This is Dr. Lederman.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe.